I had many warriors talk about having their parathyroid removed, and they had a hard time with the recovery process. So this is an important topic. A lot of people don't talk about getting parathyroidectomy. You would know, you see a line right here. Most people, when they get to surgery, they cut right there to remove the parathyroid gland. So let's jump right into it and talk about what it is, what PTH is. I'm sure you hear about it a lot. Your dietitian comes around, your doctor talks to you about it, taking your phosphorus binders, getting Zemplar or any other type of Calcigex type of medication. So PTH, what does it stand for? And as I mentioned earlier, PTH stands for parathyroid hormone, okay? And if you're on dialysis, you will recognize it as one of your routine blood tests. Yes, every month they draw a PTH level. This hormone is made by your parathyroid glands. These small glands are located right behind the thyroid gland in your neck. All right, now let me tell you, the key purpose of the parathyroid glands is to keep the calcium and phosphorus in the blood at a constant normal level. So that's why that matters, the PTH. Let me repeat that. This is how important this gland is. The key purpose of the parathyroid gland is to keep the calcium and phosphorus in the blood at a constant normal level. If, for example, the blood calcium would become low, the parathyroid gland would respond, all right? If your calcium was low, the parathyroid gland will respond by secreting more PTH. This extra PTH then would pull calcium from your bones, okay? Correcting the low blood level. This give and take response works well until the kidney begins to fail, okay? So it's like a balancing act. And then once your kidneys start to fail, this balancing act gets thrown off, okay? So when your kidneys fail, there are several reasons, all right? There are several reasons why an increase in PTH is common with kidney failure. All right? There are several reasons why. As blood phosphorus levels rise, so do PTH level. Second, the diseased kidney cannot activate vitamin D. That's why we give you the vitamin D medication. Without activated vitamin D, calcium cannot be absorbed from your intestines into your blood. When the blood calcium level drops, the parathyroids respond by producing more PTH. Hyperparathyroidism, an enlargement of the glands often develops. Then even more PTH is produced. So you got a over hyperactive gland that's producing or secreting this hormone, PTH. So with kidney failure, decrease in activated vitamin D leads to decrease in calcium, which increases the PTH or causes hyperparathyroidism. All right, so that's why when the kidneys fail, it's a balancing act. That's why they tell you to take your phosphorus binders, all right, to try to keep these labs in check. You may see people who had a bone disease that at one time they may have been tall and they shrunk. I've seen that a lot. Or people with brittle bones. Yes, this happens. So again, let me go over this. When the kidneys fail, there are several reasons why an increase in PTH is common with kidney failure. One, as blood phosphorus level rises, so do PTH levels. Second, the diseased kidney cannot activate vitamin D. Without activated vitamin D, calcium cannot be absorbed from your intestines into your blood. When the blood calcium level drops, the parathyroid responds again by producing more PTH. Hyperparathyroidism, an enlargement of the parathyroid glands, often develops because of this process. Then even more PTH is produced. And as I mentioned, kidney failure leads to decrease in activated vitamin D, which leads to a decrease in calcium, which increases more secretion of PTH, which causes hyperparathyroidism. So, what are the signs? What are the signs and symptoms of hyperparathyroidism, enlarged overactive parathyroid? You may have had this, and you may know. If you do, and if you're watching this broadcast, please interject and let us know if you did experience this, and if you got a hyperparathyroidectomy, and how you recovered. So again, what are the signs and symptoms of hyperparathyroidism? You need to notice if you or your parent or loved one undergo hemodialysis in an outpatient unit or even at home. You need to know about PTH. And as we move on, we're about to talk about what are the signs and symptoms of hyperparathyroidism. But before we do that, let's take a pause for the cause and go with a PSA advertisement by Urban Health Outreach Media.
Chronic kidney disease is a serious and growing public health problem in the United States. More than 20 million Americans aged 20 and older may have chronic kidney disease. In addition, many African Americans with risk factors, diabetes, and high blood pressure do not know they are at risk. Are you at risk? Be aware. Get tested. For more information, contact the Urban Kidney Alliance, Inc. at 443-814-1541.
Okay guys, we're back. So what are the signs and symptoms of hyperparathyroidism or enlarged overactive parathyroids? One, your PTH levels become high. If you're watching this show right now and you just started dialysis, or you are on dialysis, you've been there for a while and you really never kind of paid attention, start paying attention to your PTH levels. Excuse me. The goal is to keep the intact PTH between 150 and 600. Okay? 150 and 600 should be your goal for your PTH level. Let me repeat that. 150 to 600. Anything lower than 150 or anything higher than 600, you're out of range. 2, another signs and symptoms of hyperparathyroidism, your bones weaken. Okay, your bones weaken. This may cause bone pain and fractures, even small hairline fractures. Very important. And 3, this is one that I've seen a lot, and I'm sure some warriors can contest to this. Calcification. Calcification of tissues and organs can occur throughout the body. The lungs, the heart, blood vessels, joints, and skin may be affected by calcification. How many people heard of calciphylaxis? High PTH levels will cause bone disease plus calcification of tissues. This is real. I've seen people in hospital because of calcification of tissues or joints, or couldn't even get transplant because they had too much calcium in their body. That's why this education is so important. Please share this. And also share all our broadcasts when we talk about these important education topics. How can these problems be avoided that I just talked about? High PTH levels, weakened bones, or calcification of the tissues and organs. How can these be avoided? Well, one way these signs and symptoms can be avoided is keeping your phosphorus below 5.5. Do you follow that? Again, keeping the phosphorus below 5.5 is one key way to decrease these problems. Both diet, very critical, and phosphate binders can help. That's why we say, take your phosphorus binders. Take them with meals. Don't take them before, or don't take them after. Take them with your meals. That's when they are more at work and do their job. Again, don't take those binders before you eat or after you eat. You take them right when you're eating. We got to keep this phosphorus down, guys. We don't want you to walk around with hyperparathyroidism, which can lead to calcification, which could possibly also lead to calciphylaxis. Now, I may be pronouncing that a little wrong, but you know what I'm talking about. All right. Now, I've seen people get amputations behind calciphylaxis. 2, medications with vitamin D can be given. All right. Exemplar is a medication that is often used, or vitamin D medicine. I'm sure if you're on dialysis, you've seen us come around and give you vitamin D medication, whether it's Exemplar or what's the other one? Exemplar or Hectorol. That's another one. Hectorol, Exemplar. DaVita use a lot of Hectorol. You may see Fresenius may use Exemplar. But these are vitamin D that helps keep your phosphorus levels in control. Also, a medication called Sensipar. You may have heard of that. It's also available. It works directly on the parathyroid to decrease PTH production. Sensipar is the medication that works exclusively and directly on the parathyroid to decrease production. That's why they give you Sensipar. So definitely take these medicines if you don't want any long-term adverse effects from overproduction of PTH. It comes as a pill and is taken at home. And can your PTH level ever become too low? What do you think? Can your PTH level ever become too low? And what is your role as a kidney warrior? What is your role in helping to decrease this? So there's two things we're going to talk about after this PSA by Urban Health Outreach Media. Can your PTH level become too low, and what is your role as a kidney warrior to keep these levels low or keep these levels in check? All right, we're going to get right to it right after this PSA. Enjoy. All right, guys. All right. Thank you for watching those PSA videos. And on that first one, I African Americans with the faces of African Americans with kidney disease, as you saw people standing there holding that chalkboard, if you're on dialysis, you know you're not alone. Had one gentleman who was on that photo shoot, 25 years on dialysis, started when he was around 17, 18 years old. Name was Laird Marshall. God bless his soul. He passed away maybe about 2 years ago. And very great gentleman. Unfortunate, got kidney disease at a young age. So, can your PTH level be too low? If it could be high, then of course it could be low. You remember I gave you the range, 150 to 600. That's where those numbers should be at. 150 to 600. If you don't get anything else out of this broadcast, just remember your PTH should be between 150 and 600. Now, can your PTH be too low? Absolutely. If the PTH is less than 150, this is known as adynamic bone disease or low bone turnover. Let me repeat that. If PTH is less than 150, right? This is known as adynamic bone disease or low bone turnover. And if it's low, bone weakening and bone fractures are again common. Okay? That's why that 150 to 600 is critical, that you keep it in that range. Now, low bone turnover may happen if the parathyroid glands become overly suppressed with vitamin D medication, such as Zemplar. So what they're saying is, if they give you too much Zemplar and suppress, right, that gland, it can keep your levels low and cause low bone turnover or adynamic bone disease. So that's why you got to be really mindful with these guys when they say they're giving you your Zemplar or your vitamin D. You want to know the dosage, okay? You want to know how much vitamin D are you getting, because let's say if the doctor ordered 5 micrograms of Zemp, right? And you got a nurse who's new, and she's on her own now, and she's a grad nurse, and she's not really too sure about her medication computation, or she overdraws some medication or whatever. You know, they do have medication errors. And so as a result of a medication error, you can get adynamic bone disease by getting too much Zemplar, which can suppress your parathyroid glands. So you want to be mindful and educated on how much Zemplar or vitamin D medicine you get. When the nurse, if you have a flow sheet or treatment sheet, it's on that, so you can look at it, and when the nurse comes around and about to administer that medicine, you can ask her, how much are you getting? So because they are constantly changing these dosages. And so if a nurse misses the change because the dietitian makes the changes, based on your lab results, and that's how they titrate or manipulate the dosage based on your lab work. And so if those changes are not picked up, and then if they change your dose, like to lower the medication, and they didn't get that, and you still getting a high dosage, guess what? Possibly suppress the parathyroid gland if you still have them. That's why it's important to watch what's going on. And that's why we constantly do these shows. Whether you're here to get the information, that's on you. But we're going to do it whether it's 0 people in the room or 100. We're going to keep doing this until at least one person gets this. Okay? Now, what is your role? Okay? What is your role in keeping your PTH levels in check? Now, let me tell you what your role is. Because if you don't know your role, if you're not mindful of your role, a lot of problems can meet you coming down the road. Okay? Bone pain, bone fractures, calcification of your organs, joints, a lot. So this is your role, guys. This is what your role is to keep this in check. 1, monitor your lab values. All right, and if you don't understand, ask the dietitian or the charge nurse or us here at Urban Health Outreach Media to help explain that to you. But monitor your lab values, especially your calcium, phosphorus, and PTH. Those 3, very important. Know what your blood values are, guys. Your calcium, your phosphorus, and your PTH. Compare your blood levels to what the company that you go to recommended levels. You go to Fresenius, compare it to what their recommended levels are. If you go to DaVita, the same. These are to keep phosphorus at 5.5 or less. Your calcium should be at 10.2 or less. Okay? Calcium should be at 10.2 or less. Not too low, but you don't want to get it too high. Okay? Again, you can have, if you have low phosphorus levels, that can cause problems. If you have low calcium levels, it can cause problems. So you just got to watch your values and know what they're supposed to be. All right? And check out your intact PTH level as well, which is supposed to be between 150 and 160. Okay? PTH level should be between 150 and 160. And work with your dialysis team to keep lab values normal. Again, come to treatment on time. Don't let them cut your time. Take your phosphorus binders with meals, not before and not after, but with your meals. Pay close attention to your lab values. Keep your phosphorus under 5.5 and keep your calcium less than 10.2. Okay? And just make sure you're watching the nurses and you know what dosage of Zemplar or vitamin D medicine you are receiving, so you don't get over medicated to suppress your parathyroid gland from producing, which in turn will cause adynamic bone disease or low bone turnover. Okay, so hope you enjoyed this 45-minute education on PTH. I hope I accomplished my goal by letting you know what PTH is. We said it stands for parathyroid hormone. And the key purpose of the parathyroid glands is to keep the calcium and phosphorus in the blood at a constant level. We said that these two small glands, which are the parathyroids, are located behind the thyroid gland in your neck. We talked about what will happen when the kidneys fail and how the PTH response. We talked about what are the signs and symptoms of hyperparathyroidism or enlarged overactive parathyroids. We talked about how can those problems be avoided, and we also talked about can your PTH level be too low. If you didn't catch this broadcast, if you're just tuning in and watching this broadcast, I strongly encourage you, once this is over, to go back and replay this broadcast so you can get an idea of what this education was about. Again, what is PTH? What happens when the kidney fails? What are the signs and symptoms of hyperparathyroidism? How can those problems be avoided? Can your parathyroid or PTH or can your PTH level become low? And what is your role? That's what I discussed today, and I hope I accomplished my goal. If you're watching and you understood this broadcast, and that you can take the information that was taught today, take it back with you to your unit or wherever you're at, and to apply it to your situation and what's going on in your life with kidney disease. So guys, thank you so much for tuning in for this special kidney disease education broadcast. And guys, tonight, oh my God, tonight, tune in 8:30. 8:30, guys, for a special Warriors Quest show, man. I'm so excited to see this show tonight. Jared A. Brown, a dynamic host of Warriors Quest, will have on Jody Lynn, all the way from Washington State. Man, I'm in Baltimore. She's in Washington State at the other end of the coast, West Coast, and Jared is in Hooper, Utah. So I believe this is 3 different time zones, all right, that's going to occur. And, well, I'm not going to be on the show, but Jared is just a dynamic host that you're going to love this show and hear Jody Lynn's story, all right, and how she's putting her faith in God, okay, in Jesus Christ, to get that miracle kidney. She calls it her angel, and that angel is on the way. We just don't know when that angel is going to arrive, but that angel has been sent. And so watch her story, all right? Watch her story tonight, 8:30 Eastern Standard Time, USA, right here on Urban Health Outreach Media Network Facebook page, the network where you can get all your kidney disease education, advocacy, and prevention material. Thank you guys for watching. We see you tonight on Warriors Quest with Jody Lynn. and Jared A. Brown. God bless you. Oh, I forgot. Tomorrow night, 8:30 p.m. Eastern Standard Time, right here, Urban Reno Talk with Tamika and Steve. We're going to be celebrating Urban Health Outreach Media 1 year anniversary tomorrow night. And we're going to kick that off, all right, with Dawn Dawes, the new CEO of For Kidney's Sake Incorporated, located in New York. All right, she's going to tell us what is the future for Kidney's Sake since the unexpected passing of their warrior CEO, Angela L. Davis. We're also going to have on Alex Berrios out of Louisville, Kentucky. All right, longtime supporter. I met him twice in D.C., interviewed him, and he's going to shed some light on this past year with his transplant and his recent scare of a rejection episode that landed him in the hospital for about a week. So if you'd like to come on the show tomorrow, if you've been a past guest, please reach out to us so we can send you the link and you can come on, talk about a couple of minutes, see what's going on in your life at this moment, and go from there. So guys, again, tomorrow night, 8:30 p.m. Eastern Standard Time, USA, right here on Urban Health Outreach Media Network. Urban Health Outreach Media with Tamika and Steve. Join us as we celebrate 1 year Urban Health Outreach Media. All right, Urban Kidney Alliance has been around since 2014, but our Urban Health Outreach Media Network, a sister organization of Urban Kidney Alliance, has been in existence 1 year with these multiple broadcasts. So join us tomorrow night as we celebrate 1 year Urban Health Outreach Media. Again, thank you for joining the show. We see you tonight, 8:30 Eastern Standard Time, Warriors Quest with Jared A. Brown, his guest, Jody Lynn, Kidney Warrior, all the way from Washington State. We thank you. Join us again. Peace.